doing in medical practice recently.
Hi, Mike. Thank you so much. And hello, listeners. I'm a OBGYN, and I've been in clinical practice for 35 years. And I'm a consultant on the NHS in England for the last 20 years. So I deal with obstetrics and gynecology. And so there is this current outbreak that is of concern to all of us, and it has reached us in quite a big way. Not hit us fully, but it's there, and it's increasing.
Right. So in your practice, what are you seeing? What changes have you seen in the last few weeks or month or however long that you can tell us you've been noticing things with the virus? What length of time and what changes?
I would say really it's the sort of same time as you've noticed in the US that people have started taking notice. And it's been the last week, 10 days, where we are about a couple of weeks behind Italy. So, so we are now seeing the increase in cases, just like the same trajectory that was seen in China and Italy.
Right.
So we are seeing that, and the government is trying to bring in more measures. Personally, I have, we have got a group in our hospital so that we share all information that is important and relevant so that we can keep our patients safe. But also, Mike, the healthcare professionals, the nurses, the junior doctors, and anesthetists, intensivists, and doctors on labor ward and in the ER are all, facing risks themselves, and some of them have health morbidities. It's not only that somebody has to be above the age of 70 or 80 to, yes, the death rate is more in that group,
right?
But health professionals are being exposed to larger viral loads. So it's really important for the public to take into account social distancing, because you don't know when there may be a problem that's not related to COVID-19 that brings you into hospital and you need surgery, and your surgeon or anesthetist may not be there, or the beds may be occupied, as well as, it's not, even if you are an older person and you think, oh, I'll just pop out, it's not really advisable, because you may not realize that anytime somebody is ill, it occupies hospital beds and ventilators, which means somebody else is denied that. So really, it is important to do the very simple things of hand washing and social distancing that we are talking about, staying
Right.
connected through this electronic ways.
Yeah. And I call it proximity optimization. I don't like to use the fact that people are going to be distant socially, because,
Yes,
like you said, there's always electronic means we can use to stay connected.
absolutely.
And being social is very important to one's health. So
very important, especially for diabetics who are at increased risk. We know that, mental health can be a real issue. And also don't forget that, this is a time when we are telling people to stay at home. So, cases of domestic violence and child abuse may be increased. So I ask all my listeners to be watching out for your neighbors, helping people. But at the same time, one of my colleagues says social solidarity, physical distancing. That's also quite nice, isn't it?
Yeah, it is. Well, yeah, that brings up an interesting point about potentially increasing these other issues during the time when everyone's at home. I hadn't thought about that, but yeah. So, what are you seeing in the clinical settings? I mean, are you seeing that hospitals are running out of beds? Is that happening now, or are we just trying to prevent that from happening?
Yeah, we are trying to prevent that from happening in my hospital. My hospital's been pretty proactive. I don't know if you know how the NHS system works. It's a wonderful system. It's free at the point of care. So we are not asked about our insurance details or anything. Everybody gets equal care.
Okay.
So what we have done, and I certainly started doing this last week, is I looked at all my patients and converted them all into teleconsultations.
Huh.
So, and then only if they needed to be seen. So for example, they've got a real worry about having cancer, or they are particularly anxious and they're willing to take the small risk, that's when I would bring them in. So I would start off with a telephone consultation, because of course in gynecology, you can't examine women, but you don't need
Right.
to. You can do a lot of things without having to touch the patient. And so I have to say I've done now 4 clinics, and Rajiv, who you'll speak to maybe another day, my
Yes.
husband who's a spinal surgeon, he has done his entire clinic today through telephone consultations.
Nice.
And of course, there are always going to be patients who will need to come in. What we do know is there have been cases both on the maternity side, pregnant women who have had the infection. Luckily, none of them have been very ill. They've come in because of other obstetric problems.
Okay.
And but you know, the risk is there. I'm not on the front line of obstetrics anymore for the last year, but I go in to help if there is an issue. But I
Right.
really worry for my colleagues.
Right. Right. Okay. So what has changed if a woman is pregnant now during this coronavirus time as compared to a few months ago? What has changed for them? What do women need to know?
The women need to know, first of all, that this is a very new virus. And so we don't have all the information, but there is a very good position paper from the Royal College of Obs and Gynae in UK. And all the preliminary information that's coming out of China and elsewhere suggests that pregnant women are no more at risk of getting coronavirus than somebody else.
Hmm.
But having said that, pregnancy is a vulnerable state. And if you're pregnant, especially, and you have conditions like diabetes or hypertension, or you're particularly overweight or obese, all these things can be, or have asthma, these can be all risk factors. So we are telling our pregnant women that if you have any doubt, first ring. Don't just walk into hospital. You must keep your antenatal appointments. You must keep your appointments. But a lot of consultations can be deferred. You know, nowadays we can ask women, how are they feeling? Is their baby moving well? You know, if everything is all right, they may want to defer the appointment for a little while, but it needs to be through individual guidance. So hand washing, social distancing is important, but they may be working, you know, healthcare workers who are pregnant, as well as in jobs, you know, you might be in the police force or working in the supermarket. We ask you to ask your employer to say, you know, do I have to be so public facing? Can I have a job that is more, you know, a desk job, or can I work from home? We are telling women to do exactly the same, but we would want them to deliver under the care of a doctor rather than at home, or you know, in a midwifery-led unit, because we don't know exactly. We may want to monitor their baby. Breastfeeding also is considered safe, but again, individual guidance is really important. So women should not hesitate, either in the US or here in the UK, to actually pick up the phone and speak to their care provider. It's really important.
So good communication, just
Very important.
through
Hand wash.
electronic means. Through electronic means. Right?
Absolutely. Hand washing is really key, and self-isolation, which was recommended by our government. We are not entirely convinced that that's what's needed, but extreme social distancing is advisable. And also, you know, making sure that you're keeping hydrated, eating well, watching your symptoms, being up to date without getting scared.
Right. Okay. Well, you mentioned hand washing. Is there a specific method that you ask folks to follow for hand washing?
Yes. So it's really important that you download either the NHS guidance for hand washing, but it's simple. You do need to wash your hands for about 20 seconds. And it needs to be that you need to wash the front, the back of your hands, all your fingers, the tips. But the most important are your thumbs, okay? Because they are very much used. And so it's really important that some people say sing happy birthday twice, or
Yeah.
or a favorite song. But hand washing with just soap and water. And if you're outside, use your hand sanitizer, but don't clear the Walmart or you know,
Right.
or shelves, because other people need it as well. You know, they need the food. And so, you know, stockpiling is not good, because you'll end up throwing the food away, throwing
Right.
the sanitizer away.
Right. Okay. Now, what about what everyone is saying about optimizing or boosting your immune system, especially if you're pregnant? What does that look like? What do you recommend that women do that are going through a pregnancy to keep their immune system at the highest level possible?
So it's actually, Mike, it's not very different from what we tell everybody else. And it's also not very different at all from what we want people to do on a regular basis. The problem is people don't. And so the first thing we want people to do is increase the amount of antioxidants and phytonutrients that they eat through the amount of fruit and vegetables they eat. We know that there are studies to show, especially flavonoids, which are like the polyphenols in green tea and berries, dark chocolate, which is nice.
Yeah. Oh, yeah.
There's a study in China, I think that they're looking at quercetin, which is present in all kinds of green leafy vegetables and garlic and onion and things like that. They're looking to see because these studies have been shown to work with another coronavirus. I don't know if you've heard about SARS.
Yes.
That was also a coronavirus, and then MERS. So fruit and vegetables, focusing specifically on berries, all fruits, especially berries, green leafy vegetables, the beta glucan in mushrooms. These are all particularly, but you shouldn't stress on a particular fruit or vegetables. Just eat about 10 to 12 portions, and a portion is one handful.
Right.
So you're looking at eating 3 or 4 different fruits in a day and eating a big salad or a big soup, a vegetable soup. That's what you'd want to do. You want to make sure that people are really understanding the importance of sleep and identifying stress triggers. So wake up in the morning and take a deep breath and breathe out. Learn. There are lots of very good apps, which I'm sure are available in the US as well. Headspace or Calm, and there are lots of YouTube videos. Don't underestimate it, because it is one of the key things for boosting immunity. So eating whole grains and legumes are also important. But the science is a lot more for fruits and vegetables. Vitamin C, rather than a tablet, a single orange basically contains more than the vitamin C that you need. So don't stop at one orange, but make sure that you're eating a lot of fruit. And vitamin D3, I would expect everybody to be taking vitamin D3, including pregnant women. Pregnant women need other things as well, but vitamin D3, about 1,000 international units.
Okay, now what do you suggest? Is sunlight an equivalent to that, to taking a supplement for that?
If you know your levels, that's fine. It needs to be above 30. Okay, because we know that when levels are less than 8 or 10, it increases your chance of getting upper respiratory tract infections. So, it's really important that you either know your level or you take a supplement, especially during this time. Should not take any chances.
Right, especially, you're talking about pregnant women or anyone?
Everybody. Vitamin D3, studies have shown with upper respiratory tract infections that people who take about 800 international units or 1,000, you don't want to take too much, because too much also increases your risk.
Right. It's medicine. You have to take just the right amount.
Just the right. Most of the stuff you will get from your fruits and vegetables and beans and whole grains, but vitamin D3 is a good supplement, like vitamin B12, because we don't make it consistently enough with vitamin D3. And vitamin B12, of course, we wash all our fruits and vegetables. It's made by the bugs in the soil.
B12, of course, that's the one that's known.
250 micrograms a spray every day, or 1,000 micrograms if you're
spray
above.
Goes under your tongue. Is that how that works?
Yeah, it doesn't matter. It
doesn't matter.
just, yeah.
Okay, and so most of the foods that you're recommending sound to me like whole or mostly whole, minimally processed plants.
Yes.
Vegetables, things like that. Right?
Yes. Yes, because we know that from the huge study looking at the global death rates, that the single biggest reason why morbidity and mortality was increased was because of lack of fruit and lack of whole grains. So anybody who is doing a keto, paleo, Atkins, South Beach diet, I would strongly recommend don't do it, especially during this time. It's really, really important that your diet should be about 55 to 70% complex starchy carbohydrates, like the WHO says. Listen to what the WHO has to say. And that means potatoes, sweet potatoes with the skin, yam and tapioca and red rice and black rice and porridge oats and quinoa and millet and fruits and vegetables. Herbs are really important, Mike. Herbs and spices. If you can get cooking with spices and herbs, you will increase the antioxidant power of every dish by about 200%.
Nice. Okay. Definitely. Yeah, I love that. Spices are always the way to go. As far
Always.
as I'm concerned.
And a small handful of nuts and seeds. So you basically, oh, the other thing I wanted to say was zinc and selenium. Really
Yes.
important because they've been shown to have antiviral effects. So zinc is there in whole grains,
All
and
right.
selenium, a single Brazil nut, will give you your requirement every single day if you can get your hands on it. Otherwise, just lots of whole grains.
Okay. All right. Now, this, you mentioned stress. I would imagine, everyone's under stress right now because of
Yes.
just the entire situation is stressful. So we need to work on that, getting enough sleep, just, I guess, mindfulness techniques and different things like you were saying, like apps. And I would imagine I'm not pregnant, but if I was pregnant, there would be another added layer
Of
of
course.
uncertainty and
Of
stress.
course.
So it's so important. I can
It
see.
is so important, and also be very careful on social media who you follow, how much of news you listen to, because you're better off sticking with one or two reliable sources and
Right.
following accounts that make you feel good as well as give you the right information, rather than l- listening to a lot of there's a lot of fake news and a lot of um, misinformation out there, which
Right.
makes people very anxious. They don't know what to believe, and then they'll start not keeping the
Right.
social distances and things.
Yeah, yeah, and it's like what you're feeding your brain. You were talking about the food feeding
Totally.
your body, but that information is feeding your brain, so that's going to have an impact on you
Because
psychologically.
it will make a difference to your hormone levels. Your
Right,
hormone levels are very susceptible to sleep and stress. And so it's not just that your periods or your body hormones will get affected. It's all the adrenaline, the cortisol. These are all, and the body steroids. And so it's not just for everything that I'm saying
right,
is just as good for you, whether you're a child or an adult, whether you're an older person, whether whatever gender you may be, it doesn't matter. These are very simple things. Wash your hands, keep your distance from people, stay indoors. And this is a great time for you to catch up on doing all the things that you need to do,
yeah.
but also nourish your body. Really, really important.
All right. Well, I'm doing all those things. I haven't really left where I am since Sunday, I think it
Yeah.
was. I'm in the
Make
same
sure that you
place.
do your burpees and your push-ups and your skipping, because bone health is really important.
Yes,
For every
yes.
2 hours that you sit, the nurses study showed that a nurse was 25% increased chance of becoming overweight or
Mm.
becoming obese, actually. So it's really important to be keeping yourself active as well.
Yeah, yeah, I've been doing that just today. I realized I haven't been able to go to the gym to do any resistance training, so I did some push-ups and some planks.
Good.
But every single day, I've been going out with my wife, and we've been going running or
Fantastic.
walking on the greenway nearby, keeping our 6 feet away from people, but still going out and giving that
Absolutely.
the exercise.
Because we don't know how long this is going to last, Mike. There are suggestions that this can go on for several months,
Mhm.
from what we can see. Also, we haven't done the suppression tactic. The suppression tactic is what the Chinese used, where they absolutely, or South Korea and all that, I think they dampen down completely on anybody who had the infection. We are doing something called mitigation. So
Right,
we know that there is a much more infection in this community than we are actually testing for.
right.
So because a lot of infection is asymptomatic, and so we are hoping that the others will get this immunity through what is called herd immunity.
Mhm.
But what happens is then the virus can often it's not in the interest of the virus to kill the host, you understand.
Correct.
So it is in its interest to lie dormant, and so it may surface later, and we expect peaks later.
I
So
see.
this may be in with us for quite a long time.
I see.
So one needs to have these measures, mental and physical measures, that we can go through and help each other. Kindness is really important, and not write really mean things on social media or Facebook, Instagram. It's not helpful at all.
Okay.
And also to remember the healthcare professionals and all the other services. It's not just doctors, it's not just the nurses, it's also the porters, and the healthcare workers, the people who are serving us in the supermarket, in the food delivery service, the police. People need to understand that there's a lot of people out there, journalists, they're all risking their lives.
True, true. All right. You also mentioned, what about immunity? What do you know about immunity?
Well, immunity is basically your body's mechanism to fight invaders. And
Yeah.
here we have the invader called COVID-19, because it was it came up on New Year's Eve. So, that's why the 2019.
Right.
Um, and, I don't know if you know the origins, but basically we think it's from bats, then into
Yes.
civets. And so what we do know is our immune system really gets inflamed, and that's how we get chronic lifestyle conditions, which is killing, well, the top 10 conditions that kill people all over the world tend to be lifestyle conditions,
Right.
which are chronic
Correct.
inflammatory conditions. This is an acute, and inflammation is good. Inflammation is good to fight infections, you see.
Right.
So there is a good suggestion that when you do, if you are going to be, if you do know that you've got COVID or coronavirus, then one should try and be aware that it's quite useful to let the temperature rise, so that actually the pyrogenic mechanism kills the virus. So rather than just taking paracetamol, I don't know what you call paracetamol there. Is it the same?
Say again.
Paracetamol.
I don't know if I'm familiar.
Okay, like aspirin, the
Oh
other.
yeah, yeah, yeah. There you go. Okay. Yes.
Yeah. So it's important not to take medications unless you really need it, which means you've got a really bad headache or body ache. You're better off getting the temperature down through drinking lots of water, hydrating, cooling down, because we know that the body's mechanism is to kill the virus.
It's
And
trying to
if
do something good. Right. Okay.
yes, it's trying to do something good. So that's what immunity is your body trying to fight it. And when it can't, it then succumbs.
Okay. All right. This is all great advice, and especially with your background and your knowledge and the years you've had in the medical field. I mean, and also since you've been in the medical field for such a long time, is this something that appears every so often because it's a virus, or is this something that you hope we never see again? How would you view that?
I'm afraid we are going to see it again and
Mm.
again. It is a problem of globalization, increased human, population. We had it we've had the Ebola, we've had SARS, we've had MERS. This one is very contagious, but there is an issue with animal agriculture, the way
Correct.
we crowd animals, the way we crowd human beings, and it is a worry where people are not able to socially distance, for example, countries where they can't, the virus will really spread. So we do need to remember that we're all connected. Doesn't matter whether we live in Italy and this virus shows us that, right?
Right.
It
Correct.
shows us
Yeah.
that you could be living in a remote village in India, and somebody and the virus, or in the US, and actually sharing the same virus. This shows how
Right.
connected we are.
Yeah, people travel more than ever, and I think that's only going to increase. I don't see that
Yes,
decreasing. I mean, for temporarily now, it is going to decrease as we
of
have
course.
measures to
And we
combat
can
it.
see how the world is healing. You can see that the waters in Venice are clearing, the air pollution is reducing. So we know
True.
that the planet Earth is desperate to heal, like our bodies. So
Mhm.
we do need to try and learn some lessons from this,
Okay.
keep
Yep.
ourselves safe, but learn lessons as well for where we live.
Lessons like, did you mention? Do you believe that you know, is animal agriculture a contributor to these types of viruses? Is it?
Yes,
Is
because
it?
if you think about swine flu and bird flu and things like that, those are all viruses, right?
Yes.
And what happens is that you have these conditions that are not optimal at all, and so they jump from the slaughtered animal to the slaughterhouse workers, and then they go home, and it's all quite wretched. So really we have a lot of thinking to do as a population about what our role is in the
Yeah,
world.
I agree. I agree. I hope that I always look for a good thing to surface out of things like
Always.
this, and bringing up this as a discussion item, having more and more people consider this seriously as to the things that we need to move away from to prevent these things in the future. And I view animal agriculture. I see obviously we're seeing pollutants, like you said, clearing up as people are not doing their daily activities. We're recognizing the damage that we're doing on many levels, and hopefully this will serve as a wake-up call and folks
Totally.
will start reconsidering their lifestyles in all forms of lifestyles, I
And
suppose.
there's always hope, Mike. There's
Yeah,
always hope. We should never think that we don't have hope. When we have hope, we will be able to, have the courage to fight and to actually survive.
I agree. So thank you for bringing us that message of hope and with your expertise. And thank you so much for joining us. And I hope really that everyone is when we look at this in hindsight, that we will look that we have improved and we've learned from it. So thank you so
Yes,
much for joining
thank
us.
you. And people can follow what I'm posting
Oh yes.
on coronavirus and on women's health issues. They can go follow me on Instagram at Dr. Nitu Bajekal. And also on my website, I have lots of information on lifestyle medicine, plant-based nutrition, and women's health issues, www.nitubajekal.com. So Mike,
That's,
maybe you can put that on
yes,
later.
we're going to have it right below here in text so you can see that and you can go right to her website and Instagram. So thank you again.
Thank you, Mike.
All right. Bye-bye.